that is knowledge of proper dose. This is about posology. Of course, it is a most controversial topic, and this is a topic among where many different doctors have got different views and different ideas. Now some stick on to tinctures, some stick on to 30, then some to 200. Some follow Kentian method, that is ascending 30, 200, 1m, 10 mcm. Some follow the descending method, some stick on only to decimal. So what do you think is the right way or the proper dose to be selected in patient? To be honest, if you read Organon of Medicine, it is not that difficult at all. With time, you can understand. Of course, when we do a detailed study or when we take the topic posology, you will be able to understand it more, because I will be telling you different views of different doctors, let it be Kent or Stuart Close, and of different physicians who have come up with their own methods. But what is the right method? But at present, just because I have to tell a particular part, I am explaining it only how much is required. Do you know that actually Boningosson had put this puzzle in front out to all the homeopaths, that is to come up with their share about the proper dosage to the patient to be given. But none of the physicians replied, because I believe of the same reason which I explained just now, because it is controversial. But no, actually is not so. Now, of course, there is a person who has spoken a lot in his philosophy, that is none other than our very lovely Stuart Close. Now, Stuart Close has explained that what are the prerequisites for giving or knowing about the proper dosage. First is susceptibility of the patient. Second is seat of the disease. Third is nature and intensity of the disease. Fourth is stage and duration of the disease. And fifth is previous treatment. I would like to add my own 4 things to it, that is nothing but nature of drug substance. For example, if you see sarcodes and nosodes, you cannot use them in lower potency. It is advised to always use them in higher potency. Then 7th is sensitivity of the patient. The totality, the nature, the intensity, everything may point to the particular potency. But if your patient is very sensitive, you will have to reconsider your potency. Then 8th is quality of symptoms. This also helps in finding the correct potency. And my all-time favorite and a most important thing which helps in the knowledge of proper dose or choice of the proper dose is classification of disease. As I told you, I will be explaining you detail when we go to posology. But these are the important things or the knowledge of proper dose you should have. Only if you select the potency properly, then only you will ensure cure to the patient. We will go to our 7th knowledge, that is knowledge of repetition. So, knowledge of the repetition of the dose. This is also again a controversy, because people feel that you just have to give one medicine and wait, and one potency, one dose and wait. So whether I should wait or I should prescribe. Of course, these are so many things or doubts coming up in our mind. But you have to understand that knowledge of repetition of dose is not that difficult also. It depends on two things. First, whether the disease is acute or chronic, and upon the sensitivity of the patient. So some cures are only bought by 30. Sometimes you really require to give 200. Then sometimes still you give 50 ml, you don't see cure. Now depending on the potency also, the repetition of drug varies. But the knowledge of repetition of dose depends upon whether it's an acute or chronic. If it's an acute diseases are usually fast progressing. You just can't give one dose and wait for days together. You have to see whether the disease is becoming worse or more tissue damage is happening. So, in acute diseases, the repetition of dose is quite different than that of in chronic diseases. In chronic diseases also, it again depends on the sensitivity of the patient and of the class of the disease. So, this is about the knowledge of repetition of dose. Then we will go to our last knowledge. That is nothing but knowledge of obstacles to recovery and how to remove them. Now, knowledge of obstacles of recovery is nothing but two causes, that is exciting cause and fundamental cause.